And our next topic will be vasodilators and treatment of angina pectoris. Okay, angina pectoris, that's our quiz. When you say ischemic heart disease, ayun na yung discuss natin, no? A disease characterized by reduced blood supply in the heart. Okay, ischemia means there is a reduction in the blood supply in the heart, and that means there is also a reduction in the oxygen supply because it's the blood that carries oxygen. So other name for ischemic heart disease is atherosclerotic disease of the coronary arteries, or we also call this coronary artery disease. Okay, so coronary artery disease, these are arteries found in the heart and we have problems with them. That is why magre-reduce yung blood supply. So ito yung mangyayari. Merong atherosclerosis. This is the normal artery. You have here the blood flow, but ito yung problem with the coronary artery disease. Example, merong atherosclerotic plaques deposited in the wall of the arteries. Thereby narrowing it, yung blood flow will be reduced. So these atherosclerotic plaques are actually made of cholesterol. Okay? Cholesterol. Ito ha. So, yan yung problem natin. Pag tumaas yung cholesterol, especially in the blood, after some time, magde-deposit na yan. Okay? So we have to check our cholesterol also from time to time. And please be reminded that cholesterol is being produced in the body at night. So the more you eat at night, the more you'll have supply of yung precursor for making cholesterol. So, baliktad kasi tayo. Minsan, wala tayong gana kumain sa umaga, which is supposedly dapat sa umaga, sa buntag tadaghan ng ginakaon. Sa gabi man go dapat gamay lang dyan ang atong kaunon kay. Kung nagid na ang time nga nagabuhat ang atuang body ug cholesterol. Okay? Now, what is angina pectoris? Angina pectoris class is actually a condition characterized by chest pain. Okay? O lagi na siya. Angina is chest pain. So there is sudden, severe. Sudden ha, mukalit lang. Severe. This is very painful. Crushing chest pain. And yung pain na yan can radiate to the neck hanggang necklace ha. So syempre the left part here sa chest will be painful. And then, kasali yung neck, kasali yung jaw, and kasali yung likod, and even the left arm. Okay? That's how you know that the problem is in the heart. Kasi minsan, nag-heartburn tayo, feeling natin masakit yung yung heart talaga, pero it's because of the acid na nag-influx, heartburn yun. Pero pag ang pain class, kasama na yung jaw mo, kasama na yung left arm, and even yung likod mo masakit na, pwede na siyang angina pectoris. Okay? So other symptoms aside from the chest pain, the patient may experience dyspnea, and that is difficulty sa paghinga, indigestion, nausea, vomiting, and even diaphoresis. Diaphoresis means excessive sweating. So what is the cause? Bakit magkakaroon ang patient ng chest pain? Bakit mahihirapan siyang huminga? The primary cause is an imbalance between the oxygen requirement of the heart and yung supply. Meaning, economics ito. Di ba pag nag-study tayo ng economics, we are talking about demand and supply. So yung heart natin is a muscle, and for a muscle to contract, kailangan niya din ng oxygen. So definitely si heart, pag nag-pump yan siya ng blood, some of the blood will also go to the heart muscles via the coronary arteries. So what's our problem? pwedeng nagkaroon ng ganito, yung arteries ng heart, na-block siya class, kaya hindi na ngayon magkakaroon ng enough supply ng oxygen kasi konti na lang yung blood flow. Hindi na masusupply kung ano yung requirement, kung ano yung demand ng heart for the oxygen. So ang heart natin class, again, kapag nakulang ang oxygen, that's the time you experience chest pain. Okay? Is that clear? This is different from arrhythmia, ha? Arrhythmia is a problem involving the impulse. Okay? So yung conductance ng heart natin sa velocity, kaya siya nag-pump, nag-beat. Okay? Yung sa heart failure, ganun pa rin. The coronary arteries are our problem din sa heart failure, kaya lang yung most of the time affected is yung body. Hindi na nagkakaroon ng enough supply ng oxygen, yung all over ng body natin, kasi nagka-problem yung heart. Pero sa angina class, this is concentrated in the heart alone, ha, magkaka-chest pain ang patient. So yung mga people with heart failure, pwede din silang may angina. Okay? Kasi may problem nga sila sa coronary arteries nila, kaya kulang ang supply sa body, kasama na dun ang heart. So pag ang heart nagkulang ng oxygen, magkakaroon sila ng angina, makaka-experience sila ng chest pain. Okay? So next meeting, we will be discussing types of angina. We have here the following types of angina. I-discuss natin yan. Yung pathophysiology also ng angina, and most importantly, our drugs for angina. But do not worry kasi we have actually encountered them. The ito mga organic nitrates natin, hindi talaga ito siya bago sa inyo. This is actually very common in the market. And then yung calcium channel blockers, na-discuss na din natin ito. Babalikan lang natin siya konti next meeting. Beta blockers, so mostly paulit-ulit lang yung ating drugs for hypertension, heart failure, arrhythmia, and angina. May mga bago lang tayong idadagdag like trimetazidine. I believe you're very familiar with trimetazidine, yung Angimax in the market. And what's the other brand name? Yung may MR sa last, I forgot. Angimax, and yung pinaka-common, kanang kapoy kaayo buntingon kay zigzag-zigzag. Nakalimot ko sa iyang brand. Pakitanaw sa inyohang duty next time. Nakalimot ko sa iyang brand. Bastarel. Okay, Bastarel MR. That is trimetazidine. So next time na ma-encounter ninyo siya, you should know that that is a drug to prevent angina. Okay? And other drugs, I will also discuss this, the Evabradine. Parang brand name ng Evabradine, Coralan, if I'm not mistaken. And then we will also discuss pentoxifylline, the Trental, and the Pletaal, yung color pink, yung lalagyan niya, yung kanyang blister pack. Okay? So, tatapusin ko yan siya on